Welcome to Ortho Reports podcast. Sometimes a case comes along that is just fascinating. Today, we're diving into one of those. It's the story of a 5-year-old girl, a simple fall, and what turned out to be a truly one in a million injury. We're talking about a break so severe it could have affected the growth of her entire arm. And the solution? Well, it had to be just as elegant as it was delicate.
So this really brings us to the central challenge, the question that the surgeons had to answer. How in the world do you fix a catastrophic break and a full dislocation in a tiny, growing bone without messing up its future growth? I mean, this wasn't your typical fracture. It was this incredibly complex puzzle where just one wrong move could lead to permanent, lifelong consequences.
Okay, so before we get into the how, let's just take a moment to really grasp the stakes here. I want you to understand just how unusual and, frankly, dangerous the situation was. We're not talking about a typical playground tumble.
So get this. A fracture at the top of the upper arm bone, what we call a proximal humerus fracture, is already pretty uncommon in kids. It accounts for less than 5% of all their broken bones. But what happened in this case? Oh, it was way, way rarer than that, as you're about to see. And this right here, this is the absolute crux of the problem. You see that small area of bone? That's the proximal humeral physis. It's the growth plate. And it's not just any growth plate, it's a powerhouse. It's responsible for a staggering 80% of the arm's total growth and length. 80%. So you can imagine, any damage here, it's not just about a crooked bone. It could mean one arm ends up permanently shorter than the other. The stakes couldn't be higher. So when the doctors diagnosed this, they used a specific scale, and what they found was a Neer-Horwitz Type IV fracture. Now, what does that mean? It means it's the most severe classification you can get. The break went right through that critical growth plate and shattered the head of the bone. But, and this is a big but, to make matters even worse, the top of the arm bone wasn't just broken, it was completely knocked out of the shoulder socket. A full dislocation on top of the worst possible fracture. This combination is just incredibly, incredibly rare.
So you're probably wondering, how does an injury this severe even happen to a little kid? Let's get into the patient's story.
It all started with a 5-year-old girl on a train. She fell maybe about 5 feet from a berth and landed directly on her outstretched hand. You can just imagine the scene when she got to the hospital. She was in severe pain, her shoulder was visibly deformed, and she couldn't move her left arm at all.
Okay, so this presented a massive challenge for the surgical team. I mean, think about it. You've got to realign a severe fracture and a full dislocation all in a tiny, growing arm, and you absolutely cannot damage that all-important growth plate. The answer? Well, it had to be incredibly precise, and it had to be minimally invasive.
And here's where the elegance comes in. They came up with this brilliant 2-step solution. First step, no big open surgery. Instead, they performed what's called a closed reduction. So they carefully manipulated her arm from the outside. It's almost like solving a 3D puzzle under the skin to guide the bone back into its socket. Then, for the second step, while watching on a live X-ray, they inserted these super thin surgical pins, called K-wires, right through the skin to lock all those fragile broken pieces securely in place. Just brilliant. And this is why this technique is such a game changer. Minimally invasive sounds nice, but it's not just about a smaller scar. It means way less trauma to all the surrounding muscles and tissues. It means a lower risk of complications. And this is so critical for a kid. It means they can start moving and healing so much faster.
So, the big question, right? Did this elegant, delicate fix actually work? Because at the end of the day, the success of any surgery is all about the patient's recovery. Let's take a look at how she did.
Honestly, the results were just astounding. Get this, just 2 weeks after surgery, she was already out of the immobilizer and starting gentle exercises. Fast forward to 3 months, and she had nearly her full range of motion back in her shoulder. And then, the best part. In only 6 months, this 5-year-old was back to just being a kid, playing sports, running around with absolutely no pain and no limitations. And if we back up a little, that first big sigh of relief came right after the procedure was done. The post-op X-rays confirmed it. The surgeons had absolutely nailed it. You could see the fractured pieces were perfectly aligned. The joint was right back home in its socket, and those K-wires were holding everything steady, exactly where it needed to be.
But really, this is the result that matters most. Months later, the follow-up exams confirmed the ultimate goal had been achieved. It wasn't just that the bone healed perfectly. It was that the growth plate, that powerhouse we talked about, was completely untouched. There was zero sign of any growth disturbance, and that meant her arm would grow normally, just as it was supposed to. A total, complete success.
So what can we learn from this one incredible case? Well, it provides a really powerful set of lessons for surgeons on how to approach these super complex and thankfully very rare injuries in kids.
So what are the big takeaways? What's the clinical lesson? Well, it's that success in these cases hinges on a whole strategy. It's not just one thing. It starts with a lightning-fast and, more importantly, accurate diagnosis. Then it demands a surgical approach that's a perfect balance. It's got to be stable enough to hold the bone, but delicate enough to preserve that precious growth plate. And it finishes with getting that patient into guided rehab early. That early movement is absolutely vital for a fast, full recovery.
And that really leaves us with a final thought, doesn't it? What other medical challenges can we solve by finding this perfect balance between surgical innovation and the body's own natural ability to heal? This case is just such a powerful reminder of the incredible healing potential we have, especially in children. It shows what's possible when our interventions don't just overpower an injury, but instead they work in harmony with the body's amazing capacity to recover. Thanks so much for listening to Ortho Report's podcast.